And as the Delta variant continues to spread across the U.S., more ICUs are reaching capacity. All of it happening while the Southeast braces for impact from Hurricane Ida. NewsNation's Felicia Bolton has the latest on hospital preps and the ongoing efforts to save lives of people battling COVID-19. Felicia.
Bay is quite a difficult situation. Medical experts are very clear. COVID-19 patients are getting younger and sicker faster than ever before. In New Orleans specifically, ICUs are being pushed to the limit. And with hurricanes quickly approaching, hospitals are forced to decide who needs treatment now and who needs to find care elsewhere. From Florida to Oregon, the increase in COVID cases are pushing hospitals and ambulance services to the max. Nationwide, more than 100,000 COVID patients are in ICUs, forcing companies like Life Flight Eagle to provide air ambulance services for patients in dire need.
They're seeing really sick patients, and it's exhausting mentally and physically.
In Florida, the hospitalization rate has nearly tripled in the last month. Emergency rooms are now putting up tents for patient drop-offs just to deal with the increase, all as Hurricane Ida approaches.
All these facilities are just full, and it's heartbreaking, that these patients can't get to where they need sometimes.
The growing storm is targeting the Gulf Coast, including Louisiana, Mississippi, and Alabama. In New Orleans, 84% of ICU beds are full as Hurricane Ida draws near. Many patients admitting they are unvaccinated, with less than 65% of the city's total population having received at least one dose. In Alabama, a bleaker picture. According to the Alabama Hospital Association and the state's Department of Public Health, there were negative 29 intensive care unit beds available on Wednesday night, meaning 29 more patients were in need of ICU care than there were beds available. In Mississippi, the state's top public health official says no ICU beds are available in about 20 of the state's top-level hospitals.
There is no doubt that logistics and patients in hospitals, this particular storm is going to create some real challenges for us to deal with. But we do believe that we've made the necessary decisions and taken the necessary steps to get the additional and necessary assets and resources here that we will be able to move those patients and do everything we can to make sure that anybody that can get better quality care receives that quality care.
Medical experts say the Delta variant is even affecting states as far out as Kansas.
We're turning down 2/3, 3/4 of the transfer requests we have. We usually accept 2/3 or 3/4, but we just don't have the bed capacity to do that right. So that's a concern.
The new strain is also more likely to cause serious illness in unvaccinated individuals and even children. Now, doctors are hoping the full FDA approval of Pfizer's vaccine will encourage vaccine-hesitant people to get the shot and stop the spread of COVID-19 as the threat of massive storms continue. And right now, hospitals are scrambling to come up with COVID-safe evacuation plans if the hurricane directly hits them. In addition to PPE, the medical crews will also have to have hurricane gear to protect them from heavy rain and strong storms. And they're afraid that things might get a lot worse.